Hello everybody. Here we'll discuss how to deal with the Cbahi survivor. When you are dealing with the Cbahi, you have to be confident, relaxed, and then maintain eye contact, be professional, and then watch your behavior, real language. You have to know that your answers is from the policy and the tools and like that. So be smart that you know that the questions is aimful to that one. So when you are looking to the questions, you just be professionally, and then if you don't know the answer, you just say that you don't know the answer, or you just say that we'll just seek for find somebody who knows the answer, and then you ask or just find out. For the most common questions, you know that we start for the blood transfusion, for example. When we start the blood transfusion, the main concern is about transfusion reaction. If there is reactions, what you have to do? Clamp, and then you will drop the normal saline, inform the doctor, take your reaction form from the blood bank, and then send samples and do monitor your patient. For the DVT, yes, form, it is there, it's applied by the doctor. In the admission time, it is screened and kept in the file. You just check it when the patient is admitted into your department. For patient identification, we have the patient who is Saudi. He's having 4 names, who's none. He has to identify about himself. Just ask him to state his name, and then you state his name. For the comatose patient, no, you will check the bracelet, and you will identify with the medication label, for example, or something like specimens or the order. For the patient who's patient who's similar name, you have to know that the patient is having similar name, but the ID only. You just put the patient in mind that the ID is different, and the patient date of birth. So this is the 2 identifier for the patient with similar name. And when you are managing this type of patient, you have to name alert him with the tag for both of them. Different nurses has to be, different rooms, and different healthcare provider. When you are administering medication, has to double checking, let the patient to be educated about this important of identification. If the patient is unknown, has to be labeled with unknown and in the ID. Okay. And then we get the procedures and any investigation or procedure as unknown, even if he is none. If you know about the patient after 2 days, it will be unknown. Okay, then after discharge, you will join or integrate the files after the discharge from the medical record. For the patient who's a pre-op and post-op, put in mind that the patient having 3 types of process. You have to do it: procedure identification, site marking, timeout, which is very important to start. This one carry out immediately before starting any procedure. But the signing by the doctor, procedure identification by the nurse, both nurses, the department nurse and the OR nurse. While the site marking by the doctor, it will be for the limbs and into the skin, and not for the wounds or something like mucous membrane or internal OR, internal gastrointestinal, for example, or something. No, it will not be marked for there. Put in mind that the sign of that site mark, it will be as an arrow. Okay. Regarding isolation, there are 3 types of isolation: droplet, airborne, and contact. Contact, it will be with the green color, the airborne will be with the blue color coded, and the droplet, it will be with the pink. Okay, so this tags has to be put for the patient sign as in the door according to the type of isolation, whether contact or airborne or droplet. But for the patient who's COVID, now maybe we'll use both type, I mean contact with airborne or contact with the droplet. So mixed color, green with the blue or green with pink. Okay, it will be tagged on the patient door. The droplet, it will be dealt like with the surgical mask for COVID patient. Airborne, no, to be with the N95. The N95 fit test has to be after 2 years, or there's change in the patient, in the staff, her condition, or her change in his weight or her weight, for example. So that will do the fit test. Otherwise, every 2 hours. For the N95. N95 has to be wear for the airborne, as we said, and to be put in biohazard bag after the finishing the procedure, and take care that to be labeled, and if it is moist or wet or damaged, has to discard, and every day, every shift has to be discard. Okay, every shift and every damage. Okay. You know that there is a PPE, how you will wear the PPE, how you will remove the PPE. Maybe they will not ask you, but they will see how you are doing that one. Put in mind, firstly, when you are taking on or putting on your PPE, firstly you have to do your hand hygiene. Then you get your gown, you get your face mask, then the eye face shield, then lastly it will be the gloves. While removing, you just remove the most dirty, which is what? Will be the gloves, the gown, then after that, in between you have to do hand hygiene, okay? Then the face mask, the face shield, then the face mask, then you have to do the hand hygiene, okay? For the high alert medication, put in mind that to be labeled. High alert medication example, that will be electrolytes and not to be stocked there in the stock of the medication room. It is rarely, but if it is stocked, has to be locked, because it is supposed to be dispensed from the pharmacy for the patient, specific order for a specific patient, but has to be tagged with the high alert tag. If the patient will, you will get a medication, you have to do independent double checking, calculation, like both nurses, they will calculate, has to be separated from each other, the medication, not to be with each, and not to use the abbreviation like units for the insulin or heparin. So this is very important. For the LASA and high alert medication, you know that this is look-alike, sound-alike medication and high alert medication. Like this medication, you know that this type of medication has to put where into a special stock, like in the crash car, or like in the stock, for example, or it will be dispensed to the patient. But just take care that to be labeled with the high alerts and the LASA. LASA and high alerts, also independent double checking. Also, you have to know that it is clear order. Don't follow the verbal order or telephone order for this type of medication. You follow the 10 rights, okay? Right patient, right dose, right drug, right patient, right drug, right dose, right route, right time, right administration of the time and frequency, documentation, right reason, and then right of education and evaluation. So just take care for this all things. You know, if you are getting a medication to be given to the patient, as we said, this medication not to be telephone order or verbal order, okay? Take care for this one. You have to repeat it back for the doctor if he said for you in emergency situation this type of order. Okay. What is the meaning of LASA? LASA meaning look-alike, which is the visibly it is the same shape. While the sound like, which is the LASA, sound like medication is the spelling same. So the tall man lettering we are using for this type of medication like LASA. Making the tall letter is for the different letters, while the same letter it will be in the small man lettering, but tall man lettering is for the different pronunciation and the shape or the sounds, okay? Whether from the look or from the sound, it will be double, it will be tall man, it will be the different letter, it will be tall man. Okay. As we said, this tall man also has to be identified by the tall man, identified by tall man letters, as we said, and to be separated from each others. The containers to be labeled with the LASA and high alert, and the medication, it will be labeled also with the LASA or high alert. If this medication, we mentioned several times that not to be taken by telephone order or by verbal order, but you have to repeat it back. In such situation, maybe the patient will have a medication error report. So you just do the report if there is an error, and that one to be sent it for the medication safety officer and to follow up for investigation, and then you will see to reduce the recurrence for this medication error. The feedback we'll get it from them for what? For educational to healthcare profession or to the nurse, okay? And to prevent the near-miss hazardous condition again, okay? So it's very important to make that report, and the feedback is very important from the group of the medication safety officers so that you can take the action. So mainly when you are giving this type of medication to prevent the errors, you follow the guidelines. What do I mean? What do I mean? The ID, the Saudi, it will be 4 names, or non-Saudi, it will be according to that written, and the file that written in the file, medical record, and what is written in the label for the medication, for example. Yes, medication now. So, and the medical record number. Identify the integrity of that or the dispensed medication. If it is okay, the content is okay, the container is okay. Compare the medication with the order. You have to verify unusual dose or the volume with the pharmacy or the doctor. Don't borrow medication from other patients. Don't put your medication in the buckets. Take care, this is very important. Or gloves, okay? Use the standard as the DMC policy and therapeutic guidelines, okay? So always be doubt about your calculation. Even if you do it correctly, you just double check with your colleague, okay? It's very important. Label it. Never use any products that it is not labeled. Take care for this one, okay? You have to label that medication. Use aseptic technique if the patient, you use it for them single touch medication, like you'll give the IV medication. Aseptic technique for that one, and special basins. Don't put it in your bag, in your bucket. Okay, there is special questions that maybe they will ask about, like for example, what is the type of care delivered to the patient, okay? So you will say that it is total patient care delivery method. So what is that meaning? That is providing care or complete care for one or more patients during nursing hours, okay, or during the shift. Maybe this is a question may will be asked. So this is already previously in the last visit they asked about this question. So it is, what is the type of care delivery method or the system care in our hospital? It is the total care given for the patient. How it will be total care delivery method? It will be providing care for one or more than one patient by the nurse, okay, and within the shift. How about the staffing planning and like that? This one according to the staffing, according to the schedule, according to the value, how will distribute the staff, and according into the assignment, according to the volume of this patient and the acuity of the patient, caring hours. All these things is provided by the nurse manager. She is aware about it when she is assigning the nursing to the nurses into the patient. The acuity of patient, the volume of the patient condition, the caring hours, the size of the hospital scope services provided. So all these things has to be input in mind so that she can understand, she can adjust the assignment when giving the assignment to the staff. There is also another question that they said, what you will do if the case of shortage. So in case of the shortage, you know that you have to inform the supervisor, and then after that the supervisor will check for the cross-training list, and then after that we'll see and evaluate the staff plan in all areas, then arrange for the floater. If the patients need intensive care, one staff nurse will be pulled out from the ICU to handle that case. Okay. So this is the questions May will ask about the survivors, because this is the questions they already focus on. And then the last question from their question is, they said that is, what is the time frame for the nursing care plan upon the admission? You say it's after 2 hours initiated, and then it will be in the order, in the physician plan of care. There is a part of nursing care plan, and then we will update that one every shift in the daily reassessment in the second page. Put in mind that we are using the form of what King Fahd Specialist Hospital form, and it is available in each computer in your department. Okay, dears, thank you very much for listening for this presentation, and have good time. Thank you.